act on the complications of the disease. That is how these polyphenols, flavonoids, flavons, or whatever we call them as secondary metabolites, they play a bigger role. Not like as since a very long time we observe a proverb saying that eat an apple a day, stay away from the doctor, which means it is not that you're just eating apple and then you are just keeping fit. They have lots of antioxidants, lots of polyphenols, lots of secondary metabolites embedded into that particular fruit. Not only apple, other green leafy vegetables and other stuff. So most of the plant materials, they have these antioxidants which ameliorates lots of damages in the body. Yeah, these were the two very recent, this is very recent report. These were the two compounds which were significantly producing or potentially having this effect on SARS-CoV helicase activities. So the researchers and scientists are aiming for it as a promising drug, or anti-COVID-19 drug. Not only that, when we use medicinal plants or herbs, sometimes we eat raw material. Say, for example, in Malaysia, we eat ulam raja. Last time I was working on it. So we eat raw. And sometimes you need to cook them. Not very serious cooking, very limited cooking. And sometimes you need to do the crude extraction. So you have to make them into some crude type of extraction. And sometimes you cannot use the crude extracts, you have to go for isolations. So this is what exactly in the industries, what they do is they isolate the compounds from the crude extracts. And nowadays what is happening? Nanotechnology has emerging, it is emerging in the world, and it is giving lots of benefits because of its efficacy in drug delivery and very small size. So that is one of the most important characteristics or one of the most important advantages using nanotechnology or nanomedicine in biomedical applications. Especially we talk here about biomedical applications. If you still come narrow down, we are here talking about viruses or coronaviruses at large. Yeah, so this is how usually when we use nanoparticles or when we use nano formulations using phytochemicals, then it becomes, there are so many approaches where you can follow, like phytosomes, nanoparticles, just normal nanoparticles, any metallic nanoparticles, hydrogels, microspheres, transforms. So all these things, they carry a stabilized phytochemical, because once you prepare the nanoparticle, they are bioreduced. Once you add metal and once you add plant material, so they combine together and then they bioreduce, and plant material used as bioreductant based on the functional groups they have. So they try to reduce the concentrations of the ions, metallic ions, and then they convert. So those kind of tiny particles play a bigger role in biomedical applications, which is happening now at various stations across the globe. And whatever we do, safety is the first priority. And most of the times, people say, researchers, scientists, advocates argue that herbal drugs are widely used and safe, and widely, we claim that they are safe. But some people are there, always try to argue the efficacy, and they also believe in that, they are also drugs. They might also have some toxic effects. Of course, plant materials, there are very poisonous plants. So we cannot just pick any plant, for the namesake, and then we can use it for research or for health benefits. So we have to go with lots of processes, and we have to standardize it So standardization is most important thing, where we standardize the concentrations, where we standardize the toxicity, and finally, we use it if it is safe only, even in research. Yeah, so this is another very recent report on infectious bronchitis virus. So various types of, they have clearly mentioned about 16 plants here. So very clearly stated and reported that they have very clear potential activity towards the viruses. So these plants also might be, one of the expected plant materials to treat COVID-19, but full research needs to be done. And if we see, when COVID arrived from Wuhan, China, after that, from January 2020, February, March, they were telling lots of herbal formulas. Herbal formulas are nothing but using different types of plant materials or herbs in different proportions. That is how usually they prepare the formulations. But they claim that they have got better relief when they use the plant materials or these particular formulations. And at the same time, the disadvantages are also there. And some very significant toxic effect reports are also there, not using these particular formulations, other formulations. And what we do, most of the time we talk about antioxidants and immune boosters, but now in this COVID pandemic time, most of the times to prevent or even partial part of curing, we can take lots of immune boosters. They only can boost your immune system. It is not that they will certainly build your immune system. It is not to build your immune system. It is only to boost your immune system. Yeah, these are various types of, phyto constituents or herbals or natural products which can boost your immunity. Garlic, tamarind, lime, lemon, broccoli, almonds, sprouts, and you have oats and red bell pepper. Yogurt is also one of the very good ingredient which you can certainly have a look into. Ginger as well. And apart from these, papaya, kiwi, turmeric, and poultry. Adding proteinous food also gives you energy and also keeps you strong. So usage of, this is almost my final slide, before the last one. Usage of herbal drugs must be always under physician's monitoring. It is not that once we have the herbal drug, then you just use it. It's not like personalized medicine. So you have to use the herbal drugs or the medicinal plants or whatever you're using. You have to use it under physician's monitoring. So because drugs are drugs, whenever they are selling, the herbal drugs or plant related or natural products, so you need to understand how they have been approved, or you should ask them whether they have been approved by certain agencies. Okay, and then you can trust them and you can take. Otherwise, there will be lots of toxic effects to the body and the system. And prevention is always better than cure. Thank you. But before I say thank you, I would like to take this opportunity to inform all the participants. I think here we have almost more than 149 participants are there. So I felt it is a good platform to promote my journal. Okay, so this is what Abdurrab already know about this journal. Even we have got submissions as well for the first issue, and we are hoping for the submissions for second issue as well. So since we are talking about COVID and epidemiology, so this journal is completely related to epidemiology and diseases. So kindly, have a look into the website, and then you can try to submit your manuscripts. Or if you have any basic research, we also have another journal, which is Borneo Journal of Medical Sciences. So this is another journal where you can also try to submit for your basic research. Okay, one journal I have promoted as a chief editor, and this journal I am promoting since I am representing the faculty. Okay, thank you so much, Universitas Abdurrab,
Thank you,
for
Prof.
giving me this opportunity, for entrusting us, me and Prof. Syed, to deliver these talks. Thank you.
Thank you, Prof. And congrats for your new journal.
Yeah.
Very informative presentations.
Thank you.
For all the participants, you can keep your questions for a moment, and then you can start asking by using a chat column in the below of the Zoom room application. And then let we start the second topic. Is about university preparation and response on COVID-19. And this time it will be presented by Professor Syed Sharizman Syed Abdurrahim. Hello, Prof. Can you join us?
Yep.
Morning.
Hi. Assalamualaikum.
Open the speaker. Waalaikumsalam, Prof. Okay, before you start, please let me introduce our speaker profile for a short biography. Dr. Syed Sharizman is an associate professor of medicine and head of Department of Community and Family Medicine Department in Faculty of Medicine and Health Sciences, University Malaysia Sabah. His medical degree is from Royal College of Surgeons in Ireland and Penang Medical College in 2005. Master in Public Health in 2012 from UKM, University Kebangsaan Malaysia, and complete his Doctor of Public Health from UKM in 2009. Afterward, he began his postgraduate journey after completing study in 2016. He was assigned as a senior principal assistant director and head unit for dengue, Zika and chikungunya in the vector-borne disease sector. He began his career as an academician in 2018, joining the Faculty of Medicine and Sciences in University Malaysia Sabah. Currently, he is a head of the Department of Community and Family Medicine, and also board member for Global Journal of Public Health Medicine and managing director for Borneo Epidemiology Journal, just mentioned by Prof. Rao. He has special interest in epidemiology of communicable and non-communicable diseases and has served in vector-borne disease sector. Okay, Prof. Sharizman, for short, time is yours.
Okay, Assalamualaikum. Selamat pagi, good morning everybody.
Waalaikumsalam, Prof.
To the chairman, bapa-bapa, ibu-ibu, pelajar-pelajar semua. Saya Dr. Syed daripada Universiti Malaysia Sabah. Hari ini actually di Kuala Lumpur ada mesyuarat. Jadi yang belakang silau tu belah sini ya. Silau tu itu bukan cahaya keimanan tapi di belakang dewan. Tengah sorok-sorok memberi sebab di 15 minit kena meeting sikit. Jadi beberapa hari ni kita punya kes COVID-19 di Malaysia, terutamanya di Sabah, agak meningkat dalam beberapa minggu ni. Jadi ada sedikit perbincangan lain jugalah. Okay, so saya buka slide saya nanti. Yang slide perbincangan lecture hari ini adalah tidak begitu panjang, tapi is more of a sharing lah. Kita ni semua most of us are experts in this field. Cuma ini lebih untuk kita sharing lah sama-sama. Saya cuba nak tak nampak. Okay.
Yes, sudah kelihatan, Bro. Sudah nampak.
Okay.
Sudah nampak.
Okay, saya cuba nak shrink ini the text
full screen.
Okay. Oops. Oh, sekejap, sorry. Saya punya mouse hilang pula tiba. Sekejap. Sorry. Right. Sebentar, sorry ya.
Okay, bro. Take your time.
So bila saya share the whole audience tu nampak jadi block saya punya side of the slide. Sekejap. Okay, semua nampak kan?
Okay, nampak bro.
Okay, so it's more of a short sharing session lah, on our preparation from our university side lah, on how we prepared and response for COVID-19 pandemic. So macam semua tahu, sejak yang bulan 3 Malaysia sudah mula MCO, our movement control order. Tapi sebelum itu pun sudah Malaysia dah mula membuat beberapa perancangan preparedness and response dalam kawalan dan pencegahan COVID-19 pandemik itu sendiri. Dan di universiti kita, di Universitas Nasional Sabah, memang dari awal lagi kita sudah mula membuat beberapa perancangan dan langkah-langkah preparedness dan response lah untuk pastikan yang dalam universiti itu selamat. Sebab kita punya ada we have staff and also thousands of students in the university itself. So we had to make sure that our community, our environment of the ecosystem dalam tu pastikan selamat lah. Okay, jadi bila mula COVID-19 di Malaysia sendiri, kami sudah mula set up the whole pusat, kita panggil dia Pusat Kesiagaan dan Tindakan COVID-19, our Preparedness and Response Center inside the university itself. And our advisor is our Vice Chancellor, which is the top management that heads the whole committee. And the chairperson is our Dean of Medical Faculty. And also we have the hospital management, also part of the deputy chair. And we have several parts in the organisation lah, the big parts. Komunikasi risiko, our risk communication is from our corporate communication side of the university. Perubatan dan kesihatan awam sendiri, our medical and public health division itself ada our own head, and also lab, kepentingan perlu ada lab in terms of how to diagnose and detect these cases. Under public health and this perubatan medical side, we have contact tracing led by me, disinfection, decontamination, quarantine, mobile team, our health promotion team, as well as our secretariat for the whole bilik gerakan tu sendiri. Okay, so what are our main responsibility in this center itself? So basically we update data and current situation of COVID-19. So this is very important because we need to know the current situation outside to make sure that everything inside of our university is well and safe. And we coordinate case management, prevention and control for COVID-19 at the university level, because our staff pun ada, they come in and go from the university. Students, there are some staying inside, but there are also students yang staying outside of the university. So we need to make sure that they are all safe lah. So any cases yang that has COVID-19 positive, we have to trace them, we have to manage those cases and do prevention and control activities in the university level itself, not outside. So we coordinate our tracing activities together with the health department, Kementerian Kesihatan Malaysia lah, on the outside part. So both of us are talking to each other and we communicate on how to manage these cases well. And also we coordinate risk communication strategies in the university level itself. So when the first COVID-19 few cases struck Malaysia, especially Sabah, there were a lot of people, especially students, lecturers, they have a lot of anxiety and panic on how to manage COVID-19. Is it safe to go to work? Can they continue doing research projects? Classes can go on or not? Is it safe to be at home, to go to work, to go to the shop? So everybody was very, very anxious. So we need good risk communication, how to tell those people that it is safe, it is good, the condition is well. People need to understand, and so they don't get anxious in the university. So we have a lot of parts that we cover. On daily basis, we monitor the current situation of COVID-19, our positive cases, our persons under investigation, and also persons under surveillance, updates in the university, sama ada pelajar, sama ada kaki tangan staff from UMS itself, dan juga sampling updates, any sampel yang kita ambil daripada pelajar ataupun daripada kaki tangan, dan juga self risk assessment tu kadang-kadang bila kita ada satu sistem, kita guna UMS Shield, kita assess mereka sama ada the level of risk is high or low. If it's high, then kita kena monitor hari-hari. We do not let them come into the university. They can work from home. Self-declaration data, total patient ILI, all these are surveillance lah. Even the university itself pun we do to monitor the situation. So we have several clinics and several pusat kesihatan from the university in Kota Kinabalu, Sandakan, Labuan, and we monitor this number of patient itself. If we see high trends of cases of influenza-like illness or cerebral mind is basically our psychiatric cases, depression, anxiety. So if we see those cases increase, we need to take some action, whether we do surveillance or sampling to see whether if there's any infection of COVID-19 inside the university itself. Cerebral mind, if there's any high case of depression or anxiety, then we need to address better risk communication, counseling and whatnot. So all this is very important to be monitored routinely. Health promotion and education updates, as I mentioned, the risk communication, occupational safety and health, because the university itself is a huge ecosystem. We have lab, we have even BSL3 institute lab, so they handle a lot of chemicals, biochemicals, even biological products, and also the security, keselamatan. When they are outside, they're screening people coming into the university. They might get into contacts with people high at risk, and also even our health staff in the clinics as well. We need to be monitored. Then we have lots of issues. And we also do a lot of risk assessment to look at the current situation of COVID-19. So for example, like now, we see the cases are slowly getting higher and higher in Sabah. So we do another risk assessment around this week just to see whether is it safe for students to come into the university. Should they we revise in terms of how to manage the intake or stratify the risk of admissions to the university or not. So this meeting we do every day through our Pusat Kesangan Tindakan COVID situation analysis every day, and we also send our printed or soft copy reports to the top management in the university itself. So the whole top management knows what's going on in terms of controlling COVID-19 in the university itself, so they can plan better. And also we monitor all the cases, especially in all the districts in Sabah. So what are some of the activities that we do? We even have mobile health staff going through all the asrama, all the hostels, just to monitor that the students are doing well, especially during the MCO, movement control order the other day. There are some students left in the hostel and did not go home. So a lot of we just want to monitor whether they have any fever, any URTI symptoms, doing well or not. in the hostel itself. Okay. And then we also, this is our example of our poster. So during the MCO, we also came up with daily health education poster, just to make sure that the staff and the students are well informed in terms of risk communication. We open even COVID Cares, which is a virtual platform for psychological support portal. So during this time, we had a lot of referral from students and staff, especially a lot from students where they were very stressed out and anxious. Some of them have fever, so they were worried whether is it normal fever, is it COVID-19. So we open this portal and it's easily accessed for free, so anybody can just access this portal and convey their worries. And we have students, we have staff actually from psychiatric department, for our department actually, helping out in terms of screening those cases and being support to those people. And we have 24 hours open hotline from our center. That means anybody can just contact us in terms of if they have fever, they have any worries, they have any inquiries in terms of COVID-19, they can just contact us 24 hours. And we also monitor the number of students for every hostel in terms of movements. If there's anybody going home, coming back, where are they coming from, so we just make sure that everybody's in place lah. So this is the current situation in Malaysia. As you can see, there are certain spikes of cases recently. So usually from I think about July to August, we had almost single-digit cases. But recently in September, we have increase of cases, which is mainly from those specific clusters from Lahad Datu, Menteng, which is a prison case. So now until now, we have about 4th generation of infection from that cluster itself. So there's more than 500 cases now from there. But most of those cases are actually from Sabah. So that's one of the main problems. So we had almost 0 cases from in August and even before that. But started this month, as you can see, the trend in Malaysia actually reflects the trend in Sabah. Most of those cases actually from Sabah, from our state. So it's put us a bit in a worry in terms of managing these cases. So this October, we have students coming in to UMS. So we are stratifying the risk to see whether it's safe for the students to come in or not. If they're coming from certain areas of high-risk areas, for example, red zone or yellow zone, we might screen them or make them actually take a test. Still in discussion now in terms of how to manage these people from that zone. So we also do COVID-19 sampling in the university itself. Previously during the MCO, before the students going back to their hometowns, the state ordered to have 100% sampling before we send the students back to their hometown. So because at that time Kota Kinabalu was a yellow zone at that time, so it's a bit high risk for them to be traveling to certain green zone. So we manage by doing sampling itself in the university itself. So we manage on our own together with the help from some of the from Pejabat Kesihatan or the district health office itself. So we had a few students coming in starting from last month, and even this month we have more coming in from postgrad and undergraduate. So we already have some students having symptoms. It's natural kan? We have thousands of people coming in. Of course, at least a few will have some symptoms. Demam ke, batuk, sesama sikit-sikit kan. Ada mungkin yang rindu mak ayah, ibu-ibu di rumah, menangis-nangis sudah masuk universiti. Jadi adalah yang mungkin demam sikit, rindu ke apa. So we have some symptomatic students. And of course, we purchase our own rapid test kit for antigen testing. So we isolate those students, we sample them, and we make sure that they are negative. So all this we manage on our own inside the university itself. We don't bother the people from Pejabat Kesihatan if it's positive, then we refer back them to pejabat kesihatan lah, which is under Ministry of Health. So in the University Health Center, we slightly adjust our triaging and treatment. We make sure that there are clean areas and there are dirty areas. Dirty area means those with fever, URTI, ILI, that most probably may be symptoms of COVID-19. So it's been screened and triaged as different areas depending on the risk. Okay, so we have about three campuses with clinics, Kota Kinabalu, Sandakan, Labuan. So all of these centers, we make sure that it's running well and they monitor the warga. Warga means the students as well as the staff properly. So without these people managing these centers rightly, a bit difficult. So this center is very run pretty well to make sure that everybody's been screened properly and being surveillance properly to make sure that we kept the infection to a minimal low. So with COVID-19, we also made some opportunities. UMS, we have several labs in UMS actually. We even have a Biotech Institute lab, which is a very high-tech lab with BSL Biosafety Lab Level 3. They have 3 labs with BSL 3. But we also took the opportunity to upgrade our own faculty to have our own COVID-19 lab in our faculty itself, so we can operationally manage students, staff for testing as well. And we even have our own quarantine center. So we understand that there are thousands of students in the faculty, in the campuses. So we make sure that we have our own quarantine center. So currently we have 2, one for female and one for males in different areas of center. And also this quarantine, we have different levels. And we made use of this quarantine very well. There are some students coming from red zones with symptoms or in contacts. For example, we have recently medical students or nursing students went to the hospital and in contact with COVID-19 patient positive. So we made sure that they were quarantined here first while waiting for the results and whatnot. Okay. So it's very important to have a quarantine center in place itself in the university, so we can monitor the students well. And of course, we have disinfection activity, and according to our Majlis Keselamatan Negara (MKN) in Malaysia, any events or any conditions, we need to do disinfection pre and post. So we make sure that the whole university itself, including the lecture halls, the classroom, everything is being being disinfected. So special activities in the quarantine centers, we make sure that it's very sanitized well. Of course, this is very costly, but we have to plan it appropriately following the new norm. So we have lots in place, but also with COVID-19, there are some opportunities that we had to improve our visibility of the university. Okay. So for example, not only medical faculty, but the others faculty science, engineering, we also developed hand sanitizers on our own and face shields that we donated, and the sanitizers that we donated to the frontliners from the hospital side to the clinic side of the Ministry of Health, and also to our internal itself to the security frontliners in the university itself. So everybody pitched in, not only the medical faculty, but also other faculties as well. Everybody played their part to help out with COVID-19. And we also had the opportunity to develop a new system, which we call UMS Shields. So this is still in place until now. So there are several modules to UMS Shield, which include self-risk assessment, exit screening tool, even contact tracing when the students are in quarantine. We can even monitor them in terms of symptoms daily through the system. And this system also we monitor daily, so we can see how many staff registered here today, and how many are high risk, or how many are moderate, how many are low, and the staff in our response center can actually contact the staff immediately to see what are their risks. Should they be referred to pejabat kesihatan for swab? Are they in risk of contact of COVID-19? Can they come to work? So this has been done daily to be monitored. And also the faculty of engineering and also our GPP, our maintenance, also help develop COVID-19 sampling chamber that we donated to the State Health Department in the clinic to help them sample for COVID-19. So it becomes like a drive-through kind of thing lah. They just put their hands in, they take a sample, easy. So it doesn't waste the PPE. So this sampling can be done for a lot of people without wasting PPE resources. So all of us contribute to community as well as we work together with the Ministry of Health, not just in the university, but we also play part outside as well. And also we took opportunity while we are in the response and action center, where we monitored daily cases and we have management and we have the data of these cases. We took the opportunity to make some write-ups as well. So we have some Q1s and Q2 and Q3 and 4 as well, publications based on this COVID-19 preparedness. Our Q1 paper basically also talked about university-wide preparedness effort in alert phase. This was before the movement control order. So how we manage the university even beforehand, where we monitored the students, the tourists that are coming in the university, and we also develop validation for fear of COVID-19 scale in a Malay version. This is Q1, this is Q2, and I think this is Q4, and we have about more than that also lah. I think about 20 over papers on COVID-19, and the hospital and the university also granted more than I think about 50 or 40 research grants on COVID-19 as well, to help the researchers to develop or to produce more papers on COVID-19. So all this, even though dengan malangnya COVID-19 meningkat, tapi we take the opportunity to make sure that it benefits the other people as well. So whatever you have, you can just make use of the data, the write-ups to help other people as well, so that they know what have been prepared and to share our knowledge and experience. And also media visibility. We make sure that during this time we promote our university and our management itself. We make some predictions in terms of what has been, what will happen if there's no adherence to the movement control order. We'll see the respect of cases, but Alhamdulillah, the cases did not go this far because we maintained the case well and we followed the MCO quite well. All the sanitizers and face shield that we donated, development of UMA shield, yang ni muka bapak handsome ni give talk also to radios and TVs on COVID-19 to share experience. Right now also, if you know, Sabah actually we're having pilihan raya, polling election actually for the state. So it's a bit of a challenge with the rising cases, but also to have election at this current moment. So we started not only before, as I mentioned, we did not start at March. Most of the people started taking action during March in Malaysia during that movement control order. But we had started way before that. Even during January, we had some engagement on town hall sessions with staff regarding how to manage coronavirus, COVID-19 at that time. Top level management also, we have to make sure that the top level are well informed in terms of the situation of COVID-19. Because they need some technical and medical inputs on the current situation. So this comes our expertise, and we need to advise them how to do. Even since January, we already started monitoring our entry points in the university to make sure that there's no just any visitors can go into the university. We monitored them well. And we had daily meetings to look at the current situation of COVID-19. and we do screening in front of the gate just to make sure that everybody that goes into the university are well and safe. So on my last slide, just want to highlight, I think some of you might know this person, which is the Ministry of Health Director General in Malaysia, Datuk Sri Dr. Abdurrab. So recently for COVID-19, he was well celebrated as an icon. He's a surgeon actually, but knowing the importance of public health, he highlighted, sebagai doktor pakai bedah, saya mungkin boleh menyelamatkan satu nyawa pada satu masa, but in public health, with the correct planning, kita boleh menyelamatkan satu negara, and it's well been shown during the MCO period. Malaysia has been to show one of the best management in terms of public health lah. But of course, it's not just the management and all that, but also from everybody lah. Everybody, if you don't have a good empowerment from the community tidak patuh dengan movement control order, tidak faham, tidak ikut, memang sukar untuk menurunkan kes COVID-19 dan kawal lah. Dan Alhamdulillah, walaupun ada sekarang ada sedikit naik kes, tapi kita harap semua negara lah dapat kawal COVID-19 dengan baik selepas ini lah. Okay. Just to highlight kepentingan public health di semua negara. Okay, itu saja sharing sedikit knowledge daripada universiti kami on how we manage COVID-19 in terms of prevention, preparedness and response. Okay, mungkin ada yang mau bertanya ataupun share juga pengalaman masing-masing. Sekian, terima kasih.
Thank you, Prof. Hello. Okay, thank you, Prof. For sharing the incredible action that could be taken and prevent COVID-19 spreading in our campus. Di Malaysia orang pakai MCO, Movement Control Order. In Indonesia, we call it PSBB, Pembatasan Sosial Berskala Besar. But we still have many homework because our COVID suspect still increase. That's why Malaysian also ban our Indonesian for come to Malaysia for a short moment. All right, thank you, Prof. Okay, we are moving to our discussion sessions. Participants can leave their question in the chat column, and we will choose several questions as long as we still have time, and also the speaker able to answer the question. We will try to accommodate as many as the questions. Let me read some the question that have been given by the participant. Prof. Rao or Prof. Sheikh Sharisman can read in the column chat, but I have a short summary. The first question is about maybe Prof. Rao can start to answer the question. Yeah. It's about the how far is the development of herbal drugs to cure the coronavirus, and maybe it can be combined with how the mechanism of immune booster effect.
Okay, good.
Please.
Good questions. Good questions. So the first one is how far is the development of herbal drugs to cure coronavirus? So as I have clearly mentioned in my presentation, so whenever we are preparing, obviously the answer is very far. Whenever we are preparing some herbal drugs, it has to go through lots of processes and procedures where finally you can have the standardized product. So to have that particular formulated herbal drugs, so it may take some time, but certainly it is not cure, it is only a supplement. Whatever the herbal drug we take, or whatever the medicinal plant related products we take, or whatever the natural products we have in the market, they are only the supplements. So we cannot say that they completely treat, as long as there is a strong evidence and there is a strong approval from the certain related agencies from the country or FDA. Okay, that is the answer for the first question. Second question, how does it boost immune immunity. Okay, the overall question summary is how the herbal extracts or herbal drugs, increase the immunity. The first thing is here I have jotted down the question in 3 parts. Number 1 is mortality rate is hyperinflammatory condition, which makes blood hypercoagulation. Finally, drop the respiratory failure. Okay, mechanism of immune booster. Okay, number 1 is it actually promotes the activity of lymphocytes, and thereby usually we have the increase of phagocytes. And say, for example, I will tell you an example: garlic. If you take garlic, which is high in sulfur, so it has, it is proven to be a very good immune booster. Usually, the garlic, it has lots of beneficial effects, especially through its, phytochemicals or through its chemical compositions. Mainly, it ameliorates the, the damages of the disease, so that it certainly boosts up the immunity. And the second point is it also stimulates the, we all know, since many of the students from medical background, so they know the natural killer, activity. So it stimulates that natural killer activity. Through that, it boosts the immunity. And the second point I would like to inform also, it preserves the homeostasis of the immune system. So one example I can tell, likewise the other herbal drugs, ginger, lemon, say for example lemon, lime. Nowadays we are talking about vitamin C, but here everyone should know, because most of the participants are students, we should clearly remember that anything overdose is harmful to the body, toxic to the body. Okay, say for example people say vitamin C is good for health, so we cannot take thousands of mg per day. Okay, there is a limitation. Okay, 100 mg, 200 mg, 300 mg, something like that, but certainly it cannot go beyond 2000 mg per day. Okay, that is what usually the literature or the researchers say, or even the doctor says. Okay, so that is how usually, and we should know the concentration when we take. Even garlic, we cannot take too much. If you take too much garlic raw, it may become the irritant, gastric irritant. Likewise, the other herbal drugs, they will be having pros and cons, but everything depends on the concentration. Everything depends on the safety efficacy. That is why I have mentioned in my presentation, standardization is most important. Yeah. Next question. I want to ask a question. There is a specific and effective and most important cheap herbal that boosts our immune system, cause due to this. Okay. Octavia Lestari. So are you asking whether the price is marking up during this pandemic?
Which one, Prof? This one is?
The Octavia Lestari.
Octavia Lestari. Okay. She asked about maybe the chips herbal that can boost.
Yeah, there. Okay, is there any specific chip? No. It depends on the availability. Say, for example, we cannot say until and unless we have got the drug into the market, so we cannot say whether it's cheap or cost. But when compared to the allopathic drugs, most of the herbal drugs are cheap because of their availability. If they are not available in that particular region, certainly they might be expensive.
Okay.
Okay. Fitria.
So far.
How far is the, okay, this is done.
Yep.
Intan.
Yes, Prof.
Okay, yeah. So you have asked clearly about the mutations. So if you remember very recently, even in Indonesia and Malaysia, there was another, it is not outbreak, another group of people who have got coronavirus, COVID-19, which has been mutated, and then they have claimed that it is 10 times more severe than normal COVID. So there are possibilities to have mutated, to have the mutations in the genes. So probably we cannot say how far it can be mutated, but certainly mutations can be done. Once mutated, there is possibility to have more mutations. Okay. Lorena? So Lorena asked about the oxidation process. So usually if you take any chemical reaction, redox, we call them as redox reactions. If you take any redox reaction, there will be oxidation and reduction. But when you ask about the plant, does oxidation process from herbal will affect the toxicity? Of course, if the toxic chemicals are existing in that particular plant material, certainly there will be toxicity. But when you ask the oxidation process, when you ask about the oxidation process, it is not about the oxidation process. The toxicity is mainly due to the availability of the toxic phytochemicals available in the plant materials. Okay?
Okay, sir.
Then, yeah, I think that's all the questions. Okay, how the mechanism and side effects have been encountered herbal. Yeah. So these are the mechanisms I told: stimulating the natural killer activity, improving the phagocytosis, and also maintaining the homeostasis, preserving the homeostasis using herbal medicines, because there are lots of polyphenols and flavonoids which are very less toxic. So that's where they try to preserve the holistic homeostasis of the immune system. So that's where they try to, help you to boost the immune system and also to protect you from more damage. So that is one of the mechanisms. And if you ask me, various diseases, various mechanisms. There are lots of apoptotic mechanism, anti-inflammatory mechanism. Okay, so each compound has its own, way of working in the human body. So based on the compound structures and based on the activity of the compound, they act in the system. Yeah, thank you. I think now the questions for Prof. Said.
Yes. Please, Prof. Zaid.
Okay. How likely are children or young people to catch and transmit the virus in campus setting? We're talking about children, kan? So in campus setting, we have Pusat Minda Lestari, which is what do you call that? Preschool. It's a preschool in the university. But of course, during the MCO period, it was locked down. We did not open the preschool. And during the recovery MCO, we did open back the preschool. But however, try to maintain the SOP lah. It's not very easy to maintain the SOP. Kanak-kanak kan, dia nampak kawan saja sudah mau berpelukan sudah kawan-kawan lama. So it's not easy to monitor. But in terms of mainly that lah, we have children only in that center. Otherwise, students and whatnot, we just practice the normal SOP, standard operating procedures where you maintain social distancing. It's a bit difficult to tell whether children are having infection or not. They present with non-specific symptoms sometimes. They don't have your typical influenza-like illness syndromes or symptoms. Sometimes they just have mild diarrhea, mild fever, vomiting. And sometimes when you take the COVID-19 samples, it comes back positive. So it's a bit difficult. So that's in terms of children and young people in campus setting lah. We only have preschool centers tu je yang ada. We have children inside. Second question, I would like to know in UMS during this pandemic, the students do online studying or offline studying? This COVID-19 is very dynamic and is very fluid in terms of its condition. During the first strict MCO period, the movement control order period, everything was online. There was no student allowed to come into the university. But during the cases where it's further controlled, we switched from MCO to recovery MCO. Slowly we let the student come in, and certain areas we do allow face-to-face classes, but following the SOP lah. For example, if the room can occupy 100, we may only limit to about 20 or 30 students with distance among them lah. But again, it's fluid. So for example, if this coming cases, as you saw the graph just now, if the cases going up further and the state and the federal government say that they might reintroduce MCO, then of course it's going to go back to online session. But in general, with the population that's big, for example, medical students, that we have 90 students, that's a bit difficult to manage in terms of crowd. So it's all fully online usually until December. We see how's the situation. So it's a bit of mix. Sometimes postgraduate classes, if we have small number like 7 and we can maintain the social distance and we can do a bit of screening in terms of info and whatnot, then we can allow face-to-face. But of course, we try to encourage more of online sessions and try to reduce the face-to-face unless really necessary. For example, the psychomotor kind of teaching and whatnot lah. Okay, I think that one from our side. Datuk Yusof actually asked Indonesian university. So how you all manage an university role in Indonesia? This one I pass to you lah kan?
Yeah. But one more question, Prof. Is there any specification on or recommendation for campus ventilation or air conditioning? Because sometimes people prefer to do outside activity than inside. Is it make sense for reducing COVID spreading or kind of?
It comes down to how the COVID-19 spreads. If it's droplets, of course, it's the distance. If you make it outside, but then again, you're standing next to each other, less than 1 meter away and more than 50 minutes apart, then there's still risk of transmission. If you do it inside, but still a proper distance, and you disinfect pre and post, and rooms are quite ventilated well, so there shouldn't be any problem by right. Even though if you do have one case and you do contact tracing where you quarantine all those other people, but it's easily managed, and usually we don't have so much of a spread lah. But unless you have super spreaders lah. For example, you saw yang Singapore case kan, yang dekat church tu, where suddenly a lot of people got those cases. So that's an extreme end when you have super spreaders lah. But it comes down to how we manage the SOP lah.
How about the possibility of vaccine that will be inshallah available by this year or next year? Is it really protect us against COVID-19, or we still have, in your opinion, it still need a protocol?
Yeah, in my opinion, honestly, because coming from actually my background, mostly I was managing dengue previously, and dengue has a lot of serotypes, and the vaccine still until now is still a major problem for dengue because of the changes in serotypes and the different genotypes and whatnot. So we have to understand that this is a coronavirus infection. More than 60% of coronaviruses are actually not in humans. Most of them are in animals. We only see a few coronaviruses that jump species. For example, your SARS, your MERS-CoV, and this is the third. But however, this is the only coronavirus that caused a huge pandemic. So coronavirus acts a bit different. Some people say if you have infection, the immunity might not be so long lasting, and then even in the short period of where it came around in December until now, they already saw a lot of different mutations happening. There are almost like 12 strains around the world now, even maybe more than that if we do proper genotyping and all that. Around in I think in March the other day or May, they already found about 12 different strains of coronaviruses. So with that, is a bit of a challenge in developing a vaccine. They might have different genotypes and different strains that might react differently to immunity. Even for now, you see that different countries have different sort of reaction. For example, even America, they have huge population, a lot of people, a lot of death, and might have different serotypes for all we know compared to other countries as well. Immunity might be very different for coronaviruses because it's not a typical human virus. It's a jump species sort of virus. They might adapt well or they might mutate. In terms of the progress, I think most of the virus or most of the vaccines now are around phase 2 or phase 3. So there's still technically, if for it to be safe to go to phase 4 for community trial is still a long way, to be honest. But so far, I think safety issue, toxicity issue covered in phase 1, phase 2. But hopefully we can see it soon. Hopefully lah. Because there's no other proper protective measures besides public health measures currently. Only vaccine will be something to protect the host. Okay, so we also one question was that what should we more prepare for the future so that we can better prepare in another pandemic like this happens again? It's difficult to say because we because this is a very special kind of situation where we have severe pandemic. So most country actually, you may not or may realize it, but most of the country already have a succession plan or a preparedness plan. For example, for influenza, we learned from the Spanish flu, from the pandemic of influenza. I think most of the country already have pandemic influenza guidelines in place. So with this current, with that sort of platform where we have, it's almost the same. If you follow most of our management, we backbone or we piggyback it from our national pandemic influenza plan. Then we just modify a bit to accommodate for those airborne or droplets transmission. So it's important to have some plan initially, and then you always have to have good capacity backup. So for example, like Malaysia, when we have pandemic COVID-19, most of our labs are capable to handle the lab investigations. Most of our centers, we have regional labs. For example, public health labs in the peninsula, in Sabah, in Sarawak, in regions. We have hospital that have been upgraded the lab to make sure that the capacity can handle COVID-19 testing or even any novel viruses testing as well. So this is very important that we lay into place the foundation so that we are, if in case anything happens, you go back to the basics lah. Your surveillance, your lab investigation, your epidemiology, management, everything should be in place. So in case anything happens, you just go through. In Malaysia, nak cakap bersyukur tapi kira macam malang jugalah. If you remember last time we had Nipah virus outbreak. At that time, when we had Nipah virus outbreak, we were not prepared, to be honest. So we learned a lot from that situation, and from there on, we upgraded our public health lab. Our public health lab is actually started from that situation. So the federal government pumped in a lot of money to make sure that we are at capacity to maintain to make sure that our surveillance lab are at par lah, to the international level. So that's something that we can learn, that we can share.
Okay, thank you, Prof. Syarizman and Prof. Rao. In Indonesia, especially in Universitas Abdurrab, the same thing. We do the same thing that have been done in UMS. Our practicum or lab skill, we still do a practicum and lab skill, but in very limited student, and also in strict protocol, COVID protocol. But most of the time, our lecturer will happen in online. So it happened in online. Thank you, Prof. Rao and Prof. Syarizman. Actually, maybe we still have more question about this COVID issue, but unfortunately, there is a time limitation and we have come to the end of our webinar. Hopefully, we can continue this discussion on another time. Thank you again for our distinguished speaker for their time and their valuable knowledge. Thank you, Prof. And we still have a photo session before we are closing this webinar. And we are extremely hopeful that this webinar will be reach their goal, especially for the participant understand more about the COVID issue. And lastly, thank you for joining this webinar tonight. Thank you for all your attention. Satu pantun penutup sesama orang Melayu dengan Malaysia. Bunga selasih di teras terbuka, pohon dan atap di sebelah tingkap. Terima kasih kepada semua peserta. Mohon maaf salah dan khilaf. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Before Prof. Rao, there are a closing statement on maybe Prof. Said.
Yeah, sure. Thank you so much, Pak Dimas. So you have done it very wonderfully, and especially I like the background you have made for all the students. So it's very similar and the same background. And thanks for having us with you this morning. Thanks to Prof. Susi, thanks to Dr. Mevazan, and thanks to Dr. Ferrandri, the Dean, and the whole management and lovely students. Thank you. Maybe Prof. Said, any last word from you?
Prof. Said?
Sempat nak buat pantun.
Ya, boleh.
Sempat. Terima kasih. Thank you to everybody and everyone. We hope we can have another session of sharing with Abdurrab. It's good that we share. We have this relationship line, and hopefully, with after COVID-19 is well controlled or hopefully over, then maybe we can have some visiting sessions for your students to come to Sabah, and we can go to Abdurrab as well.
Amin.
Nice to visit.
Oke, saya serahkan kembali kepada MC. Terima kasih sekali lagi. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih kepada Pak Dimas dan Profesor Rao serta Profesor Sharisman. Dengan berakhirnya penjelasan materi, kesimpulan serta sesi tanya jawab dari webinar kita pada hari ini, maka acara webinar dalam rangka pengenalan kehidupan kampus mahasiswa baru Program Studi Pendidikan Dokter Universitas Abdurrab sesi pertama kita anggap selesai. Selanjutnya acara foto bersama. Seluruh peserta dan tamu undangan diharapkan mengaktifkan kamera dan mempersiapkan diri.
Who make accounting? Okay.
Me, Pak Dimas.
Jadi sama-sama. 1, 2.
Okay. On my mark. 1, 2, 3. Please, everyone smile.
1, 2. Okay, thank you, everyone.
Yeah. Thank you so much. See you again.
Thank you, Prof. Rao. Thank you, Prof. Sharisman.
Thank you. Terima kasih. Assalamualaikum.
Salam warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh. Thank you, Prof.
Thank you, Prof. Sebelum saya tutup, saya ingatkan kembali kepada mahasiswa baru Program Studi Pendidikan Dokter untuk melanjutkan kegiatan PKKMB sesi kedua pada pukul 10:50. Saya Nadira Bunga Muharimah selaku pembawa acara, memohon maaf sekiranya ada kesalahan dalam tutur kata dan perilaku selama acara ini berlangsung. Saya akhiri. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.